Uganda, many medical providers receive inadequate training in family planning during their pre-service education. As a result, they lack the necessary skills and knowledge to provide these services. Through the RISE program, Stopes Uganda has partnered with the Ministry of Health to provide on-the-job mentorship to health workers.
What we have realized through this partnership has been a very remarkable improvement in access to services. But why this access has been possible is because we have worked with Stopes to ensure that our own health workers, district-based health workers, have been trained to offer services, both long-term and short-term. And these health workers actually monitored, they are supervised on a routine basis by our district-based staff who have equally been trained by the Stopes staff.
I got out of school without any knowledge on practicals of family planning, without even seeing a method of family planning, like an injectable or a pill, until Stopes came and equipped us with a lot of knowledge in family planning. And everything is done accordingly to the guidelines.
Over 1.9 million clients have received free family planning services in public facilities benefiting from RISE capacity enhancement.
These people come from very far. When we give them long-term methods, they take at least a long time to come back. And we've been receiving women from other districts. They are crossing to this side because this is the nearest.
Over the years, we have seen the trend in access to services has improved, both long-term and short-term. And even when you go to communities, we see the feedback from the communities. Of course, the attitude towards family planning has changed. People have come to understand that actually family planning is an opportunity for them to decide when to have a baby and how many to have. And there's nobody limiting the number, it's based on your capacity, it is a choice.
Nyowe ekitumiri ninje neserezebwa kugira ngu nsare obusi nyina abaana mukaaga kandi bakuza kundenga kubasomesa ndeba ngu baza kunteganisa umbe ndi aho ndeba Stopes mbarabamu nderangirira niko kubahikaho kagamba nabo bakangambira izooba irindi ize bakansara kandi niza bansara.
As part of the mentorship, Stopes Uganda introduced the use of consent forms in public health facilities to document informed consent for every client taking a long-term and permanent family planning method.
I learned that every patient who comes in wants a method of family planning. You have to talk to that client. You counsel. After counseling, you give the right methods, and the patient decides on her own after hearing all the methods of family planning. Even you demonstrate, she has to touch and feel what she wants or what she's going to use. So consent is a very good method Stopes taught us.
There has also been a notable improvement in data quality and stock management at public health facilities.
We worked with Stopes, first of all, to ensure that our health workers have been trained on how to order, how to quantify the quantities which their respective facilities actually require. And I think we have seen over the time that we are having less what used to be called stockouts. Under data management, what we are doing is we have district-based trainers who actually have been super trained by Stopes team. And so these are the people who go to the facilities to continuously check, to compare the data we have in the DHS tool with the primary tools or the registers at the facilities, and we compare. Should there be discrepancy, then the team at the facility will be taken through on how to actually document these things very well. And indeed, over time, we have seen the discrepancies have reduced remarkably, and we want to thank the Stopes team for that. And for that, really, we think we are going to have good data in our facilities, and whatever ministry will be able to capture, whatever our partners will be able to capture is actually what is happening in our sites.
RISE program has supported capacity building at over 320 facilities through on-the-job mentorship of over 750 health workers to provide quality contraceptive services.